Most of the time we order MRIs, especially after 6 to 8 weeks. If they are still having pain for some unknown reason, MRIs, as far as I'm concerned, are much more predictable as far as telling me what we need to do if they're still having pain after 6 to 8 weeks. So we kind of graded on 1, 2, and 3. And 1, 2, 3 basically is 1's not so bad, and 3 is kind of the worst type of ankle sprain that you can have. You get little swelling, much more swelling and bruising, and severe swelling and bruising. But they basically are stretching of the ligament, stretching and partial tearing, and complete ligament. And that really you're only going to tell on a really good clinical exam, and if you need an MRI as well. So as far as treatment goes, there's basically 2 schools of thought. One is a functional rehabilitation, one's more traditional, and your functional is more of what your physical therapists do. I believe more of a traditional approach. I tend to keep people in a boot, walking boot for about 2 weeks, followed by physical therapy and an ankle brace. But the other option is a functional rehabilitation where they get them into physical therapy right away. I find that patients are just way too uncomfortable, way too swollen to do that. I just, in my experience, they don't tolerate it very well. The typical sprain can take about 2 to 3 months, and that's a misconception. Everybody tries to, walk it off or try to get back to activity too soon. That's when it turns into 4 to 6 months, when the average sprain will just take about 2 to 3 months. So some basic things, obviously, as far as treatment goes. Typical RICE, anti-inflammatories, immobilization. Ankle supports, this is the one that we typically use in a lace-up brace with these supporting straps. I had a patient in a cast that had his ankle fracture, and he took his x-ray and painted it right on his cast. So I always thought that was a great one. Physical therapy, as we talked about, there's some very specific things that physical therapists do for ankle sprains. Range of motion exercises, strengthening exercises, functional rehab where it's this tilt board where you're trying to stabilize the ankle, and resistance bands and things like that. But obviously their goal is to regain full range of motion, strength, proprioception ability so that they can get back to normal activity.